Hello guys, quick video for us to understand some common mistakes on Bitewing radiographs and how to avoid them. So you are seeing this image here. Of course, that's a young patient. We have some unerupted teeth and deciduous teeth, but we can already see the mistakes. Why? Because Bitewing radiographs need to serve for caries diagnosis and then the level of the alveolar crest, so marginal bone loss. Here, for example, in the mandible, we are seeing the level of the alveolar crest. Of course, we have an unerupted molar here, all right, but we can see the level of the alveolar crest. And then we are also diagnosing caries here, all right, even some initial here. We are seeing caries. Of course, if you guys don't remember how to diagnose Bitewing radiographs, go back to the video of Bitewings for beginners, all right, here on the YouTube channel. I will make the link available on the top right corner of this screen. It will show up at some point. Also an unerupted molar here, but then maybe we need periapical radiographs or even a CBCT in case of third molars. So just to let you guys know that we have other options as well. But the mistake that I'm talking about here on this Bitewing radiograph is that here we can see the alveolar crests, okay, but we cannot see the alveolar crests of the upper arch, all right, because it's not centralized vertically on the patient correctly, okay? So you need to centralize not only your X-ray source, but also the film or sensor. Of course, nowadays it's more common to see phosphorus plates, but you need to centralize the film vertically and horizontally properly in accordance to the teeth that you want to image, of course, right? So that's the mistake here. You can only diagnose the bone loss or the bone levels around the lower arch in this case. But all right, it's a young patient, challenging situations here, all right? Let's see other cases now, all right. So this, for example, is a very good radiograph, so a better radiograph because we don't even have, let me turn on here my Apple Pencil again. We don't even have superimpositions. Look, why we don't have superimpositions? Only here we have superimpositions. Because the horizontal angles were parallel to the mesial and distal surfaces of the teeth that we want to image. That's how we should take Bitewing radiographs always. Make sure that it retracts the lip and the cheeks of the patient. Make sure that the horizontal angle is completely parallel to the mesial and distal surfaces of the teeth. That's how you avoid the superimpositions. Here we don't have the superimpositions, and then we can see the alveolar crest levels on both arches, mandibular and maxillary arches. So that's fine. You can see some initial alterations here, but okay. All right, so we have initial alterations below as well. But all right, so we can see the positioning of the radiographs. Premolars here are, premolar and canine here are superimposed, but okay, you can always take a second Bitewing radiograph of premolars. Don't forget that we have two types of Bitewing radiographs, premolar Bitewings and molar Bitewings. You can have two actually because those are two different radiographs. All right, let's see another case just for us to finish. And look, here, for example, it's not so good because we do have superimpositions here. Let me turn on this. Look, not the ideal horizontal angle at all. Okay, we have more superimpositions. Okay, we can see the alveolar bone crest levels, but then the phosphorus plate is damaged. Take a look at this. So this is a those are signs of damaged film or phosphorus plate, of course. So then we should avoid that in order to diagnose the case properly. Hope you guys liked. See you guys very soon.